In this video we are going to talk about an anti-diabetic drug Glimepiride. Glimepiride belongs to the class of drugs known as sulfonylureas. It lowers blood sugar by causing the release of your body's natural insulin. Mechanism of action of Glimepiride. So Glimepiride lowers blood glucose level by stimulating the release of insulin from pancreatic beta cells. Sulfonylureas bind to the sulfonylurea receptors in the pancreatic beta cell's plasma membrane, leading to closure of the ATP-sensitive potassium channel, thereby stimulating the release of insulin. What are the indications of Glimepiride? So this drug is used in managing type 2 diabetes mellitus. What is the daily dose of Glimepiride? So by mouth in adults, initially 1 mg daily, adjusted according to response, then increased in steps of 1 mg every 1 to 2 weeks, increased to 4 mg daily. Patients need to take dose of Glimepiride before or after meal. So answer is that dose should be taken shortly before or with first main meal. What it is the maximum dose of Glimepiride per day? So the answer is that the maximum dose per day is 6 mg. Glimepiride use in pregnancy and lactation. So the use of sulfonylureas in pregnancy should generally be avoided because of the risk of neonatal hypoglycemia. Side effects of Glimepiride includes hypoglycemia, changes in vision i.e. blurred vision, nausea, vomiting, hypersensitivity, vasculitis, dermatological reactions, hematologic reactions. To stay up to date, make sure to subscribe to our channel. Thank you.